Lois Abasambo is joining us to give us a breakdown on the open heart surgery, which was carried out at the Federal Medical Center. Thank you very much, Lois, for joining us.
Thank you very much, Tina, for having me.
So the open heart surgery is normally very expensive, as patients usually travel out of the country to get it done. But for the fact that we can do it in Nigeria, it's quite commendable. Can you tell us more about the open heart surgery carried out in the FMC?
Well, Tina, I would like to start by saying that this is not the first time it is happening in Nigeria, so people don't get it confused. But this is the first time it is happening in the northern region in a very, very long time. And that's because over time, facilities have not health facilities do not have the equipment to be able to carry out these procedures. But of recent, the Federal Medical Center Abuja has been able to acquire these equipment through the help of the federal government and with collaboration of other agencies and other organizations. And they were able to get this equipment and start this open heart surgery. So we're celebrating this open heart surgery because one, it's the first in the northern region in a long while, and two, it's happening in a public-owned institution. There are quite a number of other institutions that offer these services that actually do open heart surgery, but most of them are in private hospitals or private institutions. So this actually shows that headway is being made in the healthcare sector. As much as we know that there are quite a number of challenges, this actually shows that at least something is being done to make sure that the healthcare system in Nigeria is being fixed. And it may surprise you to note that the team that carried out this procedure were a team of locals. I think there was just one of the team members that was not a Nigerian, but all other members of the team were Nigerians living in Nigeria. So that tells you that our own medical personnel are fit and are equipped to be able to carry out this kind of procedures. For the open heart surgery, it's a very complicated kind of surgery where they literally open your chest. It's called open heart surgery because they literally open your chest and fix whatever problem it is that is there. And so it's very complicated and it's very intricate. So that's why it's a major thing for us, and that's why we're celebrating it as well. The chief surgeon, and Dr. Osin Zewe, he's actually a member of the Save a Heart Foundation from UK and also has the team here in Nigeria. And we have seen him actually groom so many of the young doctors that are going to take over. So that's even another thing for the sustainability, that he's grooming up more young surgeons that will take over from him even when he's not around, that are based in the Federal Medical Center Abuja. Like the lead surgeon that is currently even in Federal Medical Center is Dr. Ali Oke. He's like the major cardiothoracic surgeon that will take over when Dr. Osi is not around. So it is a good thing for us in Nigeria. It's a good thing for us here in Abuja. So you know that you don't have to travel abroad. You don't have to go to other countries. And it also helps in reducing cost of treatments because traveling abroad is a whole lot. You have to spend a whole lot. So this is progress for us in the Nigerian health sector. Okay,
so you were there with the minister when he visited those who were recovering.
Yes.
How will you describe the recovery process of the patient there?
Funny enough, as little as in 4 days' time, these patients were already strong. There was one of the patients, Aisha, she was already walking. I visited her in her ward. She was there with her sister. She was already walking. And she was like, there was another one of the patients that when she came back, when she recovered, because you know they have to stop your heart, so it's almost like they have to stop your heart for them to carry out the surgery. So when she came back after the surgery, she was asking the nurse, "Are you done with the surgery already?" And they're like, yes. She was like, are you sure? Because it was like she didn't feel anything. She was so shocked. I spoke with Aisha. She was also one of the patients, and she's like, when she was done, she was asking the nurse, is this what I went through? Because I didn't even feel it. So it helped in boosting their confidence in the Nigerian health sector. And most of them, I think all of them have actually they've already been discharged from the ICU. So they're already in their wards. They're actually strong and are beginning to walk and actually get incorporated back to their daily lives.
Thank you very much, Lois, for that detailed update.
You're welcome, Tina. Thank you very much.
Meanwhile, Lois has packaged a detailed report on the minister's visit. Let's take a look at the report.
Minister of State for Health, Dr. Olorunniyi Mamora, during an on-the-spot assessment of the Federal Medical Center Abuja, commended the hospital management for facilitating the 4 successful open-heart surgeries in the hospital. He said the President Buhari-led administration is determined to curb medical tourism in the country by supporting such initiatives.
We've been talking of medical tourism. Why do people go on medical tourism? Because they want to look for services that appear not available back home. So these things are doable. And that is why we need to talk about it, to let people know that we have the ability, we have the capacity, we have the wherewithal to make these things happen.
Board Chairman, Federal Medical Center Abuja, Dr. Alex Tosan, said Nigeria has the human resources to carry out complicated procedures as the 4 surgeries were carried out by a team of young Nigerian health practitioners.
Dr. O.C. Nzewi, he came here and zeroed down on local Nigerian doctors who have worked with him in different parts of the world at different times, who are now resident in Nigeria. And he got them. He made a local team and headed that team that performed this open heart surgery on 4 Nigerian patients.
Also speaking, Medical Director, Federal Medical Center Abuja, Professor Saad Ahmed, said carrying out these procedures is expensive, hence the need to subsidize the cost for citizens. He called on well-meaning individuals and corporate bodies to donate to the hospital's Medical Indigence Fund, which would help in reducing the cost of treatment for patients who cannot afford it. He also appreciated the federal government for the support gotten so far.
With now the commencement of open heart surgery, it means that the managers of the Medical Indigence Fund, they need to be up and doing and also see how they can reach people from far and near to see how they can come to the aid of those that are in need. I think the ministry, through of course the Minister of State for Health, they have supported us in so many ways.
The minister had an interactive session with the 4 patients at the intensive care unit and also inspected some equipment at the hospital. Lois Apasambu, ASO Television News.